the Centers for Medicare and Medicaid Services Center for Clinical Standards and Quality brings you CMS QI Voices, an audio series that gives you a closer look at the projects and people who are improving healthcare quality and outcomes. These brief conversations include detailed show notes for even more insights into the process behind healthcare quality improvement and how you might adapt these to your own organization. In this series, CMS explores how nursing homes and Quality Innovation Network quality improvement organizations have worked together to tackle challenges related to COVID-19 vaccination, infection control, and the use of therapeutics to improve resident outcomes. Let's listen in.
Welcome to CMS QI Voices, Improving COVID-19 Outcome in America's Nursing Homes. I'm Colleen Fry, Acting Director, Division of Community and Population Health, Center for Clinical Standards and Quality at the Centers for Medicare and Medicaid Services. Today, I'm joined by Stephanie Vasquez, Infection Control Lead at Longwood Management Corporation, and Lindsay Holland, MHA Director, Care Transitions at Health Services Advisory Group. Ms. Vasquez's primary goal is maintaining high vaccination rates at Broadway Manor Care Center. She works closely with her team to create a comprehensive infection prevention plan for each resident and is dedicated to the continuing education of staff and residents about infection control. Ms. Holland has more than 14 years of healthcare industry experience with expertise in quality management, quality improvement, care coordination, and community building. She directs and develops the strategic coordination and implementation of a range of collaborative and community activities, including supporting nursing homes and improving vaccination rates. In today's episode, we will be talking about how Broadway Manor Care Center used motivational interviewing and peer ambassadors to address vaccine hesitancy and increase COVID-19 vaccine confidence. Welcome. Thank you both for joining me. Most of Broadway Manor Care Center's residents identify as culturally Armenian. How has that impacted the facility's ability to increase COVID-19 vaccination and booster uptake?
So 60 to 70% of our residents are Armenian, and they'd be more hesitant to receive the vaccine due to historical distrust of government stemming from genocide and upheaval. They are very close-knit, and a majority of their business and social relationships come from their community. Unfortunately, there is a general mistrust around vaccines and a lack of knowledge about vaccine benefits. There is also misinformation from resident and family members about vaccine side effects. In addition, language has been a barrier for some of our Armenian residents who do not speak English. So there is a need to identify family members or fellow residents who are willing and able to translate vaccine information. We address these challenges by looking at our available resources that help overcome some of these barriers. For example, our activities director is Armenian and was able to communicate vaccine benefits to residents and resident families. And our medical director also hosts a town hall and was able to provide accurate information about the vaccines to residents and family members.
Can you explain motivational interviewing and why it is an effective strategy for increasing vaccine confidence?
So vaccine hesitancy among residents and staff is an ongoing issue that many nursing homes face. So building confidence in the COVID-19 vaccine is essential. Motivational interviewing supports individual decision-making by strengthening the person's motivation to change their own behaviors. And the central focus of motivational interviewing is connecting with people at the individual level and not making assumptions about why someone may feel or act the way they do at that particular time. And it's also about supporting and respecting their choices and beliefs. So motivational interviewing empowers a person by creating an open and trusted dialogue where they can address their concerns about the vaccine and feel safe that their beliefs are respected. And as they feel free to make decisions on their own, this often moves them toward acceptance.
What motivational interviewing resources did HSAG provide the facility, and how were they incorporated into the facility's efforts to increase booster uptake among its residents?
Well, HSAG provided us several resources we used in coordination with our vaccination initiatives. First was an action plan that identified gaps in adherence and included targeted interventions we could implement, like motivational interviewing and using peer ambassadors. Second was a full speed ahead COVID-19 vaccination program website that included tools and resources for addressing vaccine hesitancy. They also shared a motivational interviewing tip sheet and role play script. And in addition, we attended a webinar on booster messaging that talked about using peer ambassadors. Actually, we were already using communication strategies and one-on-one conversations. So the motivational interviewing strategies that HSAG provided helped strengthen these conversations and reinforce our messaging. The motivational interviewing script really helped us hold more authentic conversations and open lines of communication.
Peer ambassadors are also an important part of increasing vaccine confidence. Why are they so effective?
So a peer ambassador may be anyone in the facility that people look to and trust. It can be a coworker, a fellow resident, or a staff member. And often it is not someone in a leadership position. Peer ambassadors can be formal or informal, meaning that they can be identified by leadership or just rise up as natural leaders. They serve to provide their experience about getting vaccinated and address any myths or concerns about the vaccine. And we know that we tend to listen more and follow the advice of those we know and feel comfortable with, which can build trust more quickly and easily than with someone in a more formal role. And we may be more open to getting vaccinated if a friend or a coworker has been vaccinated and encourages us to do so. And we've seen this as an effective strategy. And we've heard stories from nursing homes that tell us they've seen peers convince people who have repeatedly said no in the past.
Tell us about Broadway Manor's Peer Ambassador Program and how it helped increase their resident COVID-19 booster rate.
Well, for us, it is an informal program that evolved somewhat naturally. It started with a few residents who are seen as leaders at the facility. They received their vaccines and started talking to other residents about it. And then it was a domino effect. Once one person received it and didn't experience any negative side effects, several others decided to be vaccinated. Actually, it was a similar situation with one of our CNAs too. More staff were willing to get vaccinated after she did. This also happened with our DON. She was the first to get the new bivalent booster, and that led to more staff who were willing to get it too. This trust was established with the boosters and has continued with the bivalent as well. Even though I am newer to the facility, I still see these strategies in place, and they continue to be effective in increasing our rates.
Before we close, what's one piece of advice you'd give to our listeners about increasing vaccine confidence as they go back to their work in our nation's nursing homes?
I think that increasing vaccine confidence is an ongoing challenge and an ongoing conversation. And I think that the best way that we can have those conversations is to continue to be open, to be willing to listen, and to repeat and revisit the topic as often as needed so people feel like their concerns are heard and that their decisions are supported.
Thank you both for your time today. To our listeners, thank you for joining. Be sure to join us next time to hear more impactful interventions for increasing vaccination rates and reducing mortality in nursing homes.
To learn more about today's episode and to access all of the CMS QI Voices audio series and show notes, please visit qioprogram.org/CMS QI Voices. Thank you for listening to CMS QI Voices.